All right, we're going to talk about anesthesia and how we do local anesthesia in this office. And the first thing I want us to talk about is this is the topical we use. This topical is made by West Knoll Pharmacy. This is the greatest topical in the world, and if you use it correctly, the patient will not feel anything. This is how I want the topical used. I want a little bit, that much, put on the end of a Q-tip. I want it placed on the gum tissue in one spot, like that. And I want it covered with either a 2x2 or a cotton roll. I do not want it slathered all over the place because I'm not giving a shot all over the place. I'm going to give an injection usually in about one spot, and that's the only spot it needs to be. If you slather it all over the mouth and if you don't cover it up and they take a nice swallow, this will be washed with saliva down their throat, and because this is such a potent topical, the patient's going to think that they're choking, and they'll sit there for the next 30 minutes choking in your chair. So if you're going to use the topical, and you should use the topical, remember just one spot is where we're going to put it, and that's it. All right. Sometimes it's confusing, the different types of needles we use and the different types of anesthetics we use. So I'm going to try to make this as simple as I possibly can and talk about the different anesthetics in the practice and why they're used. So let's look in the drawer here, and we're going to pull out the different ones. This one with the red stripe, that's lidocaine. This one is Septacane. It's got the gold band. The black one is Sitnus Plain. And the one that we really rarely use, we'll talk about in just a minute, is Marcaine with the blue. Okay? So let's talk about the one that we use most often. Right here. Septacane. We use Septacane virtually everywhere except for lower blocks. That means if we're going to do any upper tooth and every single lower tooth except for lower molars, we're going to use Septacane. We're going to use Septacane in a regular syringe. You place it like that, and we're going to use a 30 gauge needle, which is a blue. Whenever you load this, load it just like that. Now if you've loaded it, make sure that the hub is set. Don't do that. Go ahead and set it, because if the worst thing that possibly can happen is we can do an injection and pull back and it's loose, and then I have to make a decision either to inject possibly in a blood vessel or to pull out and give them another shot. So you'll find that this is the most common setup. If we're treating a lower molar that's had endodontics, we'll just infiltrate, we'll go right next to that tooth. But every single tooth, and I want to show you this color chart, every single tooth, because all the upper teeth have spongy bone, so all you have to do if you want to numb any one of these teeth is put the anesthetic right next to the tooth, and it'll be numb. For the lower teeth, anything from the second premolar forward can be numbed simply by injecting right at the apex of the second premolar. There's a mandibular canal here, and it will knock out everything from there forward to the midline and there forward to the midline. So therefore, if we're going to inject on tooth number 6, we're going to give the anesthetic right here at tooth number 6. If we're going to inject on tooth 14, we'll give the anesthetic Septacane right here. If we're going to do tooth number 22, we give the anesthetic at tooth 20. If we're going to do tooth number 23, we give the anesthetic at tooth 20. If we're going to do tooth 20, we give the anesthetic at tooth 20. If that makes sense, anything forward. Okay, so this is how we utilize the most common injection in the office. All right. Now let's talk about the second most common injection in the office. That would be the block. In order to numb the molars, we have to do what's called a block. And because of the bone on the lower jaw, it's not like the bone on the upper jaw. We can't just place anesthetic next to the tooth and have it numb. We actually have to block the nerves. So we block the nerves from the bicuspid forward here, but if we're working on a molar, we have to actually go back further and block it that way. For the block is a little more complicated. For maximum comfort, typically I will give a pre-block anesthetic. So we're going to numb the area in the back with Sitnus Plain. The reason we use Sitnus Plain is because it's a neutral pH and it's non-burning and it doesn't sting. And then immediately I follow that up with lidocaine. We do not use Septacane for blocks because there's some studies that have shown that Septacane will increase paresthesia or permanent numbness, and that's a bad thing. So we don't want our patients to be permanently numb, so we don't give we don't give Septacane as a block. So, April, hop in the chair here. I will not block you, I promise, but I will show people how we would typically do this. So if you'll come around here, put the camera here. So, if I'm going to do a block for April, the first thing I'm going to do is I'm going to get my my topical, and I'm going to place it, thank you, April, open really big. Now, here's where I'm giving my injection on the lower. This is how I figure it out. I feel back here till I feel the edge of her jaw, and then where my thumb is, we go halfway through there and 1.5 centimeters back. So I know I'm going to give the shot right there. So if I'm going to give the shot right there, I'm going to place my topical right there, and then I'm going to cover it up like that, and we're going to let that set. Okay? So if I'm truly giving April a block, what I would end up doing is I would go in here, I would take this off, and I would give her injection, first one right here, with the plain and the blue. Now guess what? I screwed up. Why did I screw up? See, that's loose. That would be bad. I would be very mad. So remember, that has to be set there so that there's no give that, because when we go in there we have to pull back to make sure we're not in the blood vessel. So she would get that for the block, and then immediately following we would do the same thing with right back there, that 27 gauge and lidocaine to give the full block without stinging. I also use something called a lig jet. We use the lig jet with Septacane, and we use the lig jet in cases where we have a hot tooth that doesn't get numb as easily as it should. And this is pressure anesthesia, and we use the purple needle with that. Good for lower molars, good for endodontic teeth that don't get numb, and it's a pressure-based anesthetic with a short tip like that. All you have to do is load it up like that. Almost will never use it for uppers, use it mostly for lowers. There's also this 25 millimeters, 25 gauge needle. This is a big needle. We rarely use this. We use it almost entirely for oral surgery. Rarely used, but just so you'll know what that is. Also, this blue one, called Marcaine. We almost always use that only for oral surgery. This keeps patients numb for hours and hours and hours and hours, which with oral surgery is good because you want them out of pain for a long time. It will be in the drawer. It is not used as often. So, April, you can hop up. Now we're going to have a quick little quiz. Let's look at our chart again here. So we can see with the yellow, all of these can just be infiltrated. In other words, anything in the yellow, if we're working on any of these teeth, you can just use Septacane, 30 gauge, blue, and either infiltrate here or just go adjacent to the lower second molar, and it's done. It'll be numb in 2 minutes. It's good to go. Anything that requires a block, now with the block I'm going to actually add on to that with our purple, because it actually should go all the way here, because it doesn't just block these three, it blocks all of this. So if I have to do tooth number 18, there's no need to give any more anesthetic to these teeth, because it's going to go all the way forward to the halfway mark, if that makes sense. And then lig jet is used just to supplement. Sometimes patients have a harder time getting numb on the lower particularly, so that would be used to supplement any of these, and we give it right to the tooth. So if we're going to draw that correctly, I want the purple, I'm sorry.
You want me to extend the pink over?
Yeah, the pink would be drawn all the way over to the midline. Okay, so now let's have a little quiz. Here, Maggie, you're going to have a quiz.
Okay.
All right, let's have a pen. Can I borrow a pen real quick? I'm going to work on 2 teeth. I'm going to work on tooth number 3, and we're going to work on tooth number 28. What injections are we going to give for that?
Okay, and this one, it would need to be blocked, correct?
No.
On the molars?
It's an upper molar.
It's an upper molar, okay.
Only blocks are on lower molars.
This would be blue in the septo, right?
Yes, that's correct.
And then on this one, you would place topical on 20 because it would go all the way down, correct?
Nope, it would be on this side, because if we place it on 20, it'll go to the halfway point of the mouth. Same thing on this side. If we place it on 29, it's going to only go halfway here.
Okay.
So the answer here is we would infiltrate with 30 gauge and septo here, and infiltrate with 30 and septo here. Okay?
Okay.
All right. All right, April, come here. Now it's your turn. Another quiz. I'm now going to treat tooth number, let's X these out. I'm now going to treat tooth number 19 and tooth number 27. What injections are we giving for that?
You would do for 27, you would do Septa with blue.
Mm-hmm. Where would we give that injection?
Right by it, right at the apex of
You'd give
27.
it at the apex of 29.
29.
Because this is where the mandibular canal is. So you don't want to inject right here on the tooth because the canal's not there. You inject there and it goes forward to the midway point.
Okay.
If that makes sense.
Get it.
What would we do on that one?
On 19, you would do a block, and you'd use blue with Sitness Plain,
Yes.
Lido with yellow, and then you follow up with the purple and Septacane.
That is usually correct. Now, one caveat here, Dr. White usually does not inject with the Sitness Plain for his blocks. He will go directly straight with this. So that's one of the differences that we do. Okay? All right, I think that's pretty comprehensive. She could probably put that in, and she might put